Hi, my name is Eric, and I thought today we would broach the subject of what is a mental health evaluation intake at a hospital, and what does it mean, and what are the expectations for you, the caregiver, and you, the person that's being evaluated. So, what happens first? Well, if a family member or somebody thinks, or even you think, that you might be a threat to yourself or others, then you need to be evaluated. Even speaking out loud of wanting to die, let's say, that's not right. And if you really mean it, then you have issues with what's going on with your thoughts. So, depends on how you show up at the hospital. If you are taken in by a friend or family member, or whether you're taken in by yourself, going in and saying, I need help, or it's a mental health pickup, which could involve law enforcement or an ambulance. Well, what does an evaluation mean? Okay, so when you get to that hospital, they're going to be concentrating mostly on you, the patient. They may ask you, the caregiver, questions, or a family member for a background while they're doing the blood pressure, checking for COVID now, they're doing all these things. Once that's done, then they put you in one of the ER rooms. And they first try to rule out anything that might be going on medically. So they may run some blood tests. They may run blood tests to see if there's any drugs in your system. Low thyroid. There's a number of things that could be going on that could be causing that that's treatable. Once they rule out anything medically wrong with you, then you do an intake with either it's going to be an individual from the psychiatric ward, and it could be the psychiatrist, it could be a PA, could be a NP, or it could be just a treatment coordinator doing the intake. And they're going to ask you a bunch of questions. What's been going on and why are you here? Can you tell me what's going on right now that you're thinking, your thoughts, and if they feel that you are a threat to yourself or someone else, they have the right to do what they call a 72-hour hold. And once they decide that, you as a caregiver need to take a step back. Do not fight the system. Do not fight the doctors that are trying to help that person, the patient. You, the patient, need to listen to them and do exactly what they tell you to do. They're there to help. They see this every day in, day out. And some things are quick, simple fixes, and you're released. To some other things, it may take a little bit longer to get the drugs to therapeutic level. All right, so the evaluation is done. If they don't feel that you're a threat to yourself or others, they're going to cut you loose. They just don't have the bed space to put you upstairs when, if you just set up an appointment with an outreach clinic, is what they feel, that you could just do that without being to the ER. That's where they say that, we can't intake, we can't put you upstairs if you're not a threat to yourself or others. Even if you don't say you're not a threat, if they pick up on it, that's what's going to happen. It's what they call a 72-hour hold. All right, so you get the 72-hour hold, what happens? All right. So they need to make room for you upstairs in the unit. You're transferred upstairs, and usually the first day they put you in like a solitary confinement with somebody watching you, just kind of like suicide watch. They just want to make sure that you're okay and that you're resting comfortably. And they'll make sure that you got your meals and everything else. Don't worry about that. This is for your good. So after the initial isolation, basically, and as long as you didn't test positive for COVID, you're going to be able to go out with the general population on the unit with other patients. And that's where you'll eat your meals. There's TVs out there, phones available to call your loved ones or have your loved ones call in. And you will meet with a first treatment coordinator, and they'll ask the same questions, about what's going on, how do you feel this morning, and please, please, please be 100% honest with them. They are there to help you. They can't help you if you're unwilling to get help. Does it make sense? Everybody needs help from time to time. And you may not need medication. You may be just kind of in a rough spot in your life. And we're talking with a treatment coordinator, they can get you set up on an outreach basis for therapy, which they will arrange for you. The next person you're going to meet with is going to be the psychiatrist, and your treatment coordinator usually goes in with you. And they discuss the same things. The psychiatrist will ask you, what's going on and how long it's been going on. And at that point, he or she may feel the need to bring in some medication. And you're still on that 72-hour hold. And at this point, you're voluntary. And when I mean voluntary, most of the acute mental health hospitals with HIPAA, that if you stay voluntary, then it doesn't have to be on your record. The minute it goes involuntary, which means if you decide to fight and you're going to leave, then they can switch it over to involuntary and hold you indefinitely as long as 2 psychiatrists sign off on it. And there's usually 2 of them on the unit. So do yourself a favor. Stay voluntary. Be 100% honest with the treatment coordinator and the psychiatrist. All right. So psychiatrist decides to put you on some meds. Don't go off the deep end. There's a lot of people out there, good people that need a little bit of help. And it's okay to ask for a little bit of help. You're not less than for asking for that help. So what's going to take place is he's going to or she's going to decide on a regimen of medications. Is it going to be taken at night and morning? Is it 3 times a day? But what ends up happening is the staff, usually you have quite a number of psych nurses, and then you have aides that are there, and they're behind a glass where they can see everything. And usually there's 1 or 2 of them that are walking, within the group to make sure everybody's okay. And they will feed you 3 meals a day. They will not let you go hungry. They even have treats and snacks afterwards. But you cannot smoke. No alcoholic beverages. A lot of places restrict anything from family members being brought in that's a food source or this, because that's one way that you can drug somebody. If they're doing drugs and they end up on the psych unit, the last thing that they need and want is for you to have access to more drugs. And if they feel that it's a drug issue, they need to get you sobered up and get you cleaned up so they can get a look at the real you and then decide what to do from that point on. So there's a reason for every policy that they have. You get offended if you're a family member and they say you can't bring anything in for that person. Excuse me. So most places don't allow you to smoke. No outside food is allowed to come in. Nothing with, sweatpants can't have the strings in them. Shoes can't have shoelaces in them. That's all, for the patient's protection. So don't get offended if you're a caregiver and you want to bring X, Y, and Z in, and the staff said we can't let you. It's nothing against you. It's just their policy. And that's the same thing with visiting hours, especially during this COVID has been screwy. But so that's the drift of it. If they feel that they need to keep you longer than the 72 hours, they'll come back to you and say, look, we'd like to have you stay a little bit longer so that we can see how the medications are doing. 9 times out of 10, most patients, all they think about while they're there is leaving. They don't think about working their program or working on themselves. They just focus on, I got to get up, got to have a cigarette, got to, I feel confined, the claustrophobic. So when the psychiatrist and the nurse coordinator, the treatment coordinator suggests to stay a couple days longer, heed their suggestion and do it. They're asking you for a reason. They're there to help you. And you need to be there to take responsibility for your program and be honest with them and do what needs to be done to get yourself better. That's the goal. That's what everybody wants. They want you feeling better. Once you're released, at least up in this area, within 4 days, you have to be seen by the psychiatrist that's in the outreach clinics. The sad thing is, and I hate to even bring it up in a video, but it's kind of like the inside joke. The quickest way to get seen by a therapist and a psychiatrist is to go inpatient. And about the only way you're going to go inpatient is if they feel you're a threat to yourself or somebody else. And I've known of people that lied, that just said they were suicidal just so they could be seen 4 days after a release and get into the system. Yeah. The people that call the outreach clinic and want to set up an appointment, some are like 6-8 months out. These people are overwhelmed. They've had so much funding taken away from them, and people have left. They can't find people to replace them because they're so worried about having more funding cut, and then being out of a job. I can't blame them. It's stressful. They're there to try to help people. But if you take anything away from this video is if you go to the ER, be 100% honest with those people, especially the intake for upstairs. That's what they're there for. They see it every day. And if you don't feel safe, they can provide a safe space for you and get you on the right track. If you're a caregiver, listen to the staff. Don't try fighting the staff. Don't get angry if they don't talk to you about what's going on. They don't have to. A lot of times the patient has to sign off on a form for that group to be able to talk to somebody. And the sad thing is if the patient that's there is having issues with you, they can have it so that you won't know anything. They won't sign their paper to allow that person to speak. The treatment coordinator can listen to the caregiver talk to them, but they cannot respond on how you're doing. And as a caregiver, you need to take a step back and let somebody else handle that load for a while. I know it's hard. I know you feel like, what did I do wrong, this and that, but you need to take a step back, know that that person is in good hands, they're safe. And if they get on the program and stay on the program, they will be very thankful for what you did. If they decide to screw it up and not take it seriously, they're probably going to be pissed off at you. But too bad. If they didn't want to work their program, why should you have to worry about it? That's just my take. But that's what happens in an evaluation. They're simple questions. They're very concerned, and they rule out that it's medical, but right to, if it's not medical, then it's got to be psychiatric. So there's no in between. All right. I hope you liked the video. I know it's one of my shorter ones, but hey, probably everybody's like, "Well, yay, he's not talking as much." But all right. See you later.